Milk allergies are on the rise, especially amongst children. Early detection and management is key, and it starts with diet and nutrition. And here to tell us more about it is pediatric allergist Dr. Jonathan Malka. Welcome.
Good morning. Thanks for having me.
Happy to have you here. We are learning a lot more about food allergies, I feel like. What should every parent know when it comes to food allergies?
First of all, that food allergy has become much more of a common condition. It has doubled in the last decade, and 7 out of 10 children will likely have a food allergic type of this disease. It is an immune reaction to a protein in the cow's milk allergy known as casein. It's one of the 5 most common foods that we have in the food allergy spectrum. And the exact mechanism why they happen, we don't know, but we do know kids are at risk if they have a parent with food allergies, eczema, or other allergic conditions.
So when a child has a cow's milk allergy, what exactly constitutes that, and what are the symptoms?
So it's a great question. So the symptoms usually occur the first or second time they ingest the cow's milk protein. They will present with immediate vomiting, difficulty breathing, shortness of breath, lip swelling, diarrhea, or anaphylaxis. Or maybe more subtle chronically over the course of time may present with bloody stools, vomiting, or failure to thrive.
So what should parents be on the lookout for? Just those symptoms, or are there other smaller symptoms before you get to something to that level, such as like increased mucus or anything like that?
So that's a great question. So if you have a child who has a family history of atopy or allergies like we just mentioned, you have to understand that you may present with the symptoms right away, or may have the mucus in the stool later in the next few weeks. Those are both signs of food allergies. It is important to understand that if you find the symptoms early, you want to make sure you've talked to the pediatrician about them, because that poses a risk to develop other food allergies known as the allergic march. For example, 4 out of 10 babies with cow's milk allergy may exhibit asthma symptoms by 5 years of age or later. 2/3 of the children with milk allergy may have other food allergies such as egg and peanut. Nearly half of them will have rhinitis or itchy watery eyes or itchy watery nose later in life. And 1/3 of the children may have eczema. So it's important to understand the symptoms early, understand that if you treat or minimize the exposure or treat with the right formula nutrition-wise, you will decrease the symptoms at the present time and decrease the progression of the allergic disorder known as the allergic march.
Okay, so once a child has been diagnosed with this allergy, parents and doctors can work together to manage the allergy, correct?
100%, that is very important. It is important for the parents to talk to the pediatrician and discuss the options. One of the options for cow's milk allergy will be the use of extensively hydrolyzed formulas with the use of probiotics, such as Lactobacillus rhamnosus. When you use an extensively hydrolyzed formula in a patient combined with probiotics with milk allergy, you will improve their quality of life, decrease the symptoms of milk allergy, and also hopefully alter progression of disease and lead to less of other allergic conditions later in life. So it's important to understand early, treat early with the right formula, and therefore look for other allergic symptoms later in life.
All right, Dr. Malka, where can viewers go for more information?
So again, in addition to your pediatrician, takeallergicaction.com. That'll be takeallergicaction.com. It's a great website, physician supported with evidence-supported evidence for right education for parents.
All right, really important information for all the parents and grandparents that are watching kids today. Appreciate you, and we'll be right back with more Midday Maryland right after this. Stay tuned.